This week's policy strategy session has been on my heart really for some time. It deals with the COVID-19 crisis and what I think is at the root or very near, close to the center of the problem. And it really is something everybody can relate to. So if you notice at the president's briefings, the task force on coronavirus, it was glaring to me what was missing. You had doctors, you had epidemiologists, you had public health officials, you had economic professionals, and you had, of course, cabinet members, but you never saw the head of OSHA, Occupational Safety and Health Administration. You never saw anybody from OSHA there. I mean, what better perspective than the people who stand at the middle of public safety and occupational economic activity? That was glaring. And so, the natural thought would be it was an oversight. And, so I thought I do a lot of work, more so in the community, some of my mission-oriented work. I work with previously incarcerated, underemployed, unemployed young people in neighborhoods, and we work with them on getting into the building trades. So I do a lot of work in the safety world. And so I'm a defender of OSHA just off of that principle, even though they represent not the best practices, but just the minimum standards. And everybody knows an OSHA standard is written in money and blood. So there's a lot of great, sincere people who do good work, but I'm not going to lie about some of the shortcomings of that regulatory agency. But without OSHA, there would be a lot more people hurt and killed every year. But the problem is this: OSHA had and has no specific standard that protected workers from airborne or aerosol transmission of diseases or diseases transmitted by airborne droplets. I could show you OSHA regulations this thick, hundreds and thousands of details, nothing that covered the coronavirus. And that is really maybe the biggest problem as to why OSHA was MIA, so to speak. But safety is the keystone principle and the keystone habit that everything else can be built upon, whether it's in education, whether it's economics, whether it's athletics, whether it's art. The attention to detail that's required to make a situation safe or secure, it feeds into everything else. It makes everything else better. And so Paul O'Neill, the former Treasury Secretary, before that he was the CEO of Alcoa, he turned that company around just by focusing on safety. And so we know that this country, our businesses, and our own lives, we are not safe. And we have more of an investigation more than an inspection mentality. We correct things after they happen, after an incident or an accident, and not before. So we're not preventative. So I'm focused on looking for a bipartisan solution that will help the poorest, most exposed, most vulnerable, essential workers, lower income neighborhoods, entrepreneurs, and small businesses that are impacted by this disproportionately. And so we fired off a letter to members of Congress. I'm going to hit a couple points here and just to drive home the point. But if OSHA can get its hands around this and balance the interests of the epidemiologists and the economists, so to speak, then a lot can be done that's progressive. Okay, so five things that I think are important for government to consider. And these are policy strategy opportunities for entrepreneurs that I think have a real moment, a window of opportunity to get into the safety profession as entrepreneurs, as educators, as trainers. So first thing is what I mentioned, that there was no standard relative to airborne or aerosol transmission. Major problem. They can come up with one through an emergency effort, but the fact that there was not one tells you that there's something wrong with the way that the safety profession and businesses think about health and communicable diseases. The deficit in OSHA outreach trainers in underserved communities is the second issue that has to be tackled. The lack of Black American and Spanish speaking OSHA outreach trainers and the lack of the same in the occupational safety profession will continue to present problems in the distribution of life-saving information. So safety training and education is not going to permeate the communities that have the most exposed workers if they're not Spanish speaking, if they don't come from those neighborhoods, if they don't have tentacles and a network in those communities. Doesn't matter. You can put the CDC, 5-step poster all you want. It has to go into the heart and mind of the community. That's the support system, the social infrastructure for the worker and their family, for that small business owner and their family. That's a big problem, the lack of OSHA outreach trainers in underserved communities. Third, safety training funding for small business. So those workers and businesses who have been deemed essential in communities throughout America are often the least well trained in the best safety practices. And as these entrepreneurs and workers continue to serve us all, they should be supported in learning how to implement a hierarchy of safety controls in their place of business, and that's engineering, administrative, and personal protective equipment. All this emphasis on PPE, personal protective equipment. Anyone in the safety profession will tell you PPE is the last line of defense. You don't want to put the onus of safety fortification on the worker, the frontline individual. You have to protect them from an engineer. That means you have to build the solution, and then you have to administrate it with some managerial expertise and some rapid response adaptation. So that's a big issue. All this emphasis on PPE is putting the car, I don't want to say, it's backwards. It's backwards. Okay, and everybody knows that. You can give somebody a mask, they don't know how to put it on. Social distancing requires engineering and administrative controls, not just PPE. Okay, so small businesses, especially micro businesses, I'm going to keep singing that song. Those with 10 employees and less, they need help, and they need funding, and they need to receive training. Fourth, there needs to be a study commission between the Small Business Administration and NIOSH to discern and determine the financial cost of social distancing requirements for small businesses. So as I said, social distancing is not an adaptive behavior without financial cost to small business owners. And it can't be assumed that incorporating engineering, administrative, ergonomic, and PPE controls that are required by it, that they can be easily taken on by entrepreneurs and small business owners. So that needs to be quantified, and it needs to be the SBA and NIOSH coming together, the best minds who understand what a business has to deal with and who understands what the best safety protocols are. They have to come together and to determine what it would take for a small business owner that may have 800 square feet. The restaurant can do something that a barbershop can't. A barbershop can't do something that a stadium can. And so you need that balance and that perspective. And I think the SBA and NIOSH would be a great combination. And then lastly, I think there have to be increased reporting requirements and funding for businesses with less than 10 workers. OSHA does not require employers with 10 or less employees to keep a record of serious work-related injuries and illnesses. And so it can create a problem. The purpose of it is to lighten the burden, the paperwork burden, so to speak, of an entrepreneur or small business. But it does open the door for incidents and accidents to be underreported and underaddressed. So rather than incentivizing entrepreneurs and small business owners to not report, incentivize them to report by giving them funding along with the requirement that they have to meet. So don't just tell them you got to report more and then you don't give them a tax credit or don't subsidize what it would take for them to hire an executive assistant or an accountant or someone with some type of managerial expertise. So that, I would say in a nutshell are the 5 points. I want to talk briefly about contact tracing, because this idea that testing and tracing and treating people, the 3 T's, is the way we're going to solve this. I don't agree that we need an army of 300,000 formerly census worker individuals now becoming contact tracers. And that's what's being thrown around, turning people who take the census into people who would track individuals, perhaps, as we get into this second wave or this summer. I would rather have an army of OSHA outreach trainers, people who go out in the community and teach best practices, teach inspection, encourage people to invest in safety, and actually provide technical assistance. If you give me 300,000 OSHA outreach trainers, I'll take that any day of the week over 300,000 contact tracers who may be invading our privacy. So this is a huge opportunity for the entrepreneurially inclined. You can do a lot of good work in the safety profession. They are the second responders. You know, you hear about first responders all the time, and it's justified. But what about second responders who make sure that what the first responders do is not undone? So the safety professional is the second responder. Cedric Muhammad, Hip-Hoppreneur, the latest policy strategy. Be safe.